Okay, this is the Budget Subcommittee number 1. Ms. Mitchell is unable to be with us because of a family illness, and so she has asked me to substitute for her. We have a number of vote-only items, and then we have 3 discussion items. And so we'll begin with the vote-only items in order to try to make sure that we can get as many of those votes taken care of as possible. We're going to be keeping them open because Mr. Blumenfield, I believe, as the alternate, will be coming at some point to add on his votes. So we will begin by calling the roll.
Chesbro?
Here.
Blumenfield? Jeffries?
Here.
Mansour? Monning?
Here.
The quorum is present. So we'll go right into issue 1 on page 3 of the binder. It is funding for the long-term care ombudsman. We have a staff recommendation to approve as budgeted with associated trailer bill language with conforming approval of related BCP and the Department of Public Health, both actions conforming to Senate action. Is there a motion?
So moved.
Second. Call the roll, please.
Chesbro?
Aye.
Blumenfield? Jeffries?
Aye.
Mansour? Monning?
Aye.
Has 3.
Okay, that has 3, but we're going to hold the item open for members to add on. Department of Public Health. Issue 1 is the BCP long-term care ombudsman financing. The staff recommendation is to approve as budgeted.
So moved.
It's been moved. I'll second it. Call the roll, please.
Chesbro.
Aye.
Blumenfield. Jeffries.
Aye.
Mansour. Monning.
Aye.
Has 3.
Okay, thank you. Has 3. We'll hold it open. Issue 2, the ADAP estimate adjustments. We've decided to hold that open. Item open. Needs more time. Moving on to Department of Developmental Services. Issue 1, the Fairview Developmental Center fire alarm system upgrade. The staff recommendation is to reject the BCP. I want to make it clear this is not the same Fairview fire-related item that we had previously heard. So the recommendation is to reject the BCP.
I so move we reject the BCP.
Moved, and I'll second. Please call the roll.
Chesbro?
Aye.
Blumenfield? Jeffries?
Aye.
Mansour? Monning?
Aye.
3.
Okay, we'll hold that item open. Issue 2 is prevention program budget bill language. The staff recommendation is to approve budget bill language conforming to the Senate action. I'll entertain a motion.
So moved.
It's been moved. Second. Please call the roll.
Chesbro?
Aye.
Blumenfield? Jeffries?
No.
Mansour? Monning?
Aye.
Okay, we'll hold that open. Issue 3 is trailer bill language, regional center conflict of interest. The recommendation is to adopt placeholder language.
So moved.
It's been moved. I'll second. Please call the roll.
Chesbro?
Aye.
Blumenfield? Jeffries?
Aye.
Mansour? Monning?
Aye.
It just occurred to me with 3 votes, we don't have to be holding them open, do we?
Unless members want to add on.
I guess it's a privilege to them to come if they add on. Okay, we'll keep it open. So we're now on issue 4, trailer bill language for the regional center third-party liability. Staff recommendation is to adopt placeholder language.
So moved.
Second, please call the roll.
Chesbro?
Aye.
Blumenfield? Jeffries? Mansour? Monning?
Aye.
Okay, that has 3 votes, but we will hold the item open. Issue 5 is...
That has 2 votes.
Yes.
Oh, I'm sorry, 2 votes. Apologize for that. Issue 5, trailer bill language, regional center audits. Staff recommendation is to adopt placeholder language.
So moved.
Second, please call the roll.
Chesbro?
Aye.
Blumenfield? Jeffries? Mansour? Monning?
Aye.
Okay, we'll hold that item open. The next item is Department of Rehabilitation. Issue 1 is Department of Rehabilitation, Department of Mental Health Partnership. The staff has made us aware of some problems with the previous action, so the recommendation is to rescind the prior vote taken at the January 25th hearing and deny without prejudice conforming to the Senate action.
So moved.
Second, please call the roll.
Chesbro?
Aye.
Blumenfield? Jeffries? Aye. Mansour? Monning?
Aye.
Has 3.
Okay, we'll hold that item open. Department of Social Services, trailer bill proposal on temporary assistance program. Staff recommendation is to approve I should say, Chair's recommendation is to approve a one-year delay in trailer bill for implementation of TAP conforming to the Senate action.
So moved.
I'll second it, and please call the roll.
Chesbro.
Aye.
Blumenfield. Jeffries.
Aye.
Mansour. Moning.
Aye.
Has 3.
Okay, we'll hold that item open. Under Office of System Integration and Department of Social Services, we have the Child Welfare Services Web Project. The Chair's recommendation is to deny without prejudice, conforming to the Senate action.
So moved.
Been moved. I'll second.
Chesbro.
Aye.
Blumenfield. Jeffries.
Aye.
Mansour. Moning.
Aye.
Has 3.
Okay, and we'll hold that item open as well. So now we're going to move to discussion items. The first issue, issue 1, is Sex Offender Commitment Program Adjustment. It's on page 16 of the packet. Can I ask the Department of Finance and the LAO to come forward? Oh, they are. What do you think we should do? Should we hold that one over? Department of Mental Health is apparently late.
I don't mind if you're...
We are awaiting arrival of the Department of Mental Health representatives, so what's...
Mr. Chair, members, John Doyle, Department of Finance. I can attempt to address this issue if you would prefer.
Okay. Why don't we go ahead and have Finance present on behalf of the Department of Mental Health. The Chair's recommendation, and that I guess we're asking you to respond to, is to approve a reduced augmentation of $2.8 million to conform with the Senate action. So go ahead.
And Mr. Chair, as I would just note that your agenda correctly identifies the request that was put forward by the department for the sex offender commitment program. Based on adjustments in CDCR policies, the department is requesting an additional $6.7 million. There are those changes in policy that CDCR has put forward are things like active GPS monitoring, lifetime parole for all sex offenders, and increased sex offender monitoring in communities, including sex offender commitment stings. So we believe, obviously, that the proposal is justified based on the information that we received from the department when building the governor's budget. We understand the action taken by the Senate, but would just note that we believe that adjustments such as these are more appropriately handled as part of May revision when caseload numbers are a little more clear.
Okay, thank you. Legislative Analyst's Office.
Thank you, Mr. Chair. Members, Meredith Worden with the Legislative Analyst Office. As your agenda notes, we are defer without prejudice on this proposal. We are still evaluating some of the information the department has provided on this issue, as well as there are some outstanding requests. We're trying to determine whether or not this proposal is justified on a workload basis. Thank you.
Okay, well, my recommendation is approve reduced augmentation of $2.8 million to conform with the Senate action.
So moved.
And I will second it. Please call the roll.
Chesbro.
Aye.
Blumenfield. Jeffries. Mansour. Moning.
Aye.
Okay, we'll hold that item pending additional members arriving. Issue 2 is Mental Health Services Act State Administration. The recommendation is to adopt placeholder bill language to reduce the Mental Health Services Act state administrative cap from 5% to 3.5% to conform with the Senate action. And I want to mention, it's my understanding that the Senate included in that action holding the Prop 63 Commission harmless from that reduction, and I want to make sure that that is also part of the motion that's made here. So that's the recommendation. I'll ask Finance to respond.
We understand the action, again, understand the action taken by the Senate, and the reduction in the cap will, as the agenda correctly notes, there's already an issue with the department being over budgeted as far as the cap. And the administration will be looking at this issue as part of May revision to reduce expenditures to bring it within the 5%.
Okay. Legislative Analyst's Office? Oh, was there another comment?
Yes, Mark Heilman from the Department of Mental Health.
Oh, I would have called on you first. I'm sorry.
That's all right.
Go ahead.
I just would like to offer a few examples of how some of this administrative money is spent. For example, we fund the Office of Statewide Health Planning and Development, $895,000, and they administer our mental health loan assumption program, which forgives the loans, educational loans of individuals who agree to work in the public mental health system. We have funded about 600 people so far in forgiving those loans, and they've agreed to spend at least a year.
Excuse me, is that, in the other examples you're going to give, programs that were initiated as a result of Proposition 63, or is it essentially backfilling overhead that was previously covered by the general fund?
No, these are programs that were sponsored as a part of the workforce employment and training provision of the Prop 63. And the Office of Statewide Health Planning and Development, which has an existing loan forgiveness program, agreed to administer this program for Prop 63. We also fund the Managed Risk Medical Insurance Board, $177,000 a year, and they develop screening and assessment tools for primary care providers to identify serious emotional disturbances in children. The Department of Rehabilitation, we fund the Department of Rehabilitation $216,000 a year, and they provide information and technical assistance to the local Department of Rehabilitation system to coordinate their efforts with those of county mental health departments. And I'd point out that each dollar of MHSA money that's spent by the Department of Rehabilitation draws down $3 of federal rehabilitation money. So we're leveraging 3-to-1 with that expenditure. And finally, we fund the Department of Social Services, as example, $766,000 a year. And they provide support, assistance, and technical assistance to counties in developing tools and protocols for the wraparound program, which combines and coordinates the child welfare system with mental health services for children at the county level. So those are a few examples. And I would also point out, Assembly Member, that we publish a legislative report both in January and at the May revision, and it has a significant amount of information and detail about all the departments and boards, commissions that we fund with MHSA.
Well, those would appear to be some examples of well-spent funds. However, first of all, I want to point out that it's not an elimination. It's a reduction from 5% to 3.5%, which would require some prioritization. And then, so let me ask you about some that seem on the surface of them to be a little less obvious, such as and I'm not against libraries or the military department, but can you describe, for example, how the military department or the state library would be carrying out the purposes of Prop 63 with the funds?
Certainly. The State Library provides research assistance and, pardon me, research project assistance, and also has developed a library of materials, journals, articles, books, videos that are available for mental health practitioners to check out and review, use as reference materials in the development of programs. All you need is a California State Library card to access that collection. And the military department has been funded to provide coordination in outreach to military veterans, returning veterans, to try and identify mental health needs and link them to the system that provides that at the county level.
And why would that be done there and not in the Department of Veterans Affairs?
We also fund the Department of Veterans Affairs, and their effort is to coordinate the county Veterans Service officer organizations with the county mental health departments at the local level.
Thank you. Legislative Analyst's Office?
Thank you, Mr. Chair. We've not had an opportunity to review the potential impacts of this reduction on operations. However, in the past, we have been critical of the department focusing on a lot of administrative infrastructure instead of getting funds out to the counties for direct services. This proposal would be consistent with how we have viewed this program in the past, and to the extent that less money is spent on administrative activities, more may be available for direct services in the community.
Thank you. And under public comment, we have Mr. Felix. Yeah. Can we make sure the mic's on? Oh, okay. I assumed it was on. Didn't think I had to make you walk so far, Rusty.
Rusty Felix, California Council of Community Mental Health Agencies. The areas that the department referred to really don't get to the heart of the matter. What LAO spoke to did. When we first saw the county plans coming in at 1,000 pages long after the department had set up its administrative mechanism, we knew something had gone seriously wrong with the implementation of this act. In my opinion, the way to get to this issue is to start all over. Bring the stakeholders and the department together, and let's think about what is the appropriate department role. Because if you simply leave it to them to make cuts, they'll cut the wrong things and leave the things that are causing the counties are spending 15% of the money they get on administration, they claim, all driven by what the state is making them do. The providers that I represent say that 40 cents out of every dollar that gets to them is spent on paperwork. We have to change the whole way of doing business here, and as I view the Senate action, it was intended to send a message. Let's rethink this. We're not going about this in a very effective way. We don't have the outcome data, which is really what the Commission is seeking, which has now been given to the Commission to do. That's what the oversight should consist of, not this endless paper chase that is using up enormous amounts of staff time at both the state and local level, and we have really nothing to show for it. And I'm hoping that this action really isn't intended to say just cut, but to rethink the whole approach and to sit down with the community and figure out what really are the best use of these dollars. And if we do that, then we'll get something very good out of this.
Okay, thank you very much. We have another individual, I think, who'd like to testify.
Good morning. Kirsten Barlow with the California Mental Health Directors Association. We concur with many of the remarks that Rusty Felix was just making. I think the priority really needs to be on sustaining local services for consumers right now, and I think the Senate Subcommittee's actions and also the Assembly agenda makes a lot of good points about the importance of making sure that dollars that are spent on state administration are really those that are critical and follow what the statute lays out for what those uses are supposed to be, since every dollar that is saved at the state level does go to the community for direct services to consumers. Thank you.
Thank you very much. Well, I concur with that, and with the exception of the Oversight and Accountability Commission, who has a critical oversight responsibility. Otherwise, I think that the action is justified to, if nothing else, get the discussion going the way it's been described. So I would entertain a motion to adopt placeholder trailer bill language to reduce the state administrative cap from 5 to 3.5%, conforming with the Senate and holding the Oversight and Accountability Commission harmless from that reduction.
So move.
Second, please call the roll.
Chesbro.
Aye.
Blumenfield. Jeffries. Mansour. Monning.
Aye.
Okay, we'll hold that item open. And the final discussion item and action item is the Department of Social Services program, a proposal to continue suspension of confidential intermediary program for sibling contact. That's AB 2488. And the recommendation we're making is to approve trailer bill language for an additional 1-year suspension and reject the administration's deleted language on legislative intent conforming with this. That will be conforming with the Senate action. So we'll call on the Department of Social Services.
Good morning, Mr. Chair, members. Pete Chervinka with the Department of Social Services. Your agenda explains what this issue is. I understand the desire to conform with the Senate. I would simply note for the record that our request to eliminate, to the extent possible in terms of the intent language, what we've experienced in the last year is that this has provided an opportunity for courts, and we recognize the public policy goal, but it has presented the opportunity for courts to instruct that this occur regardless of the legislature's suspension of the actual statute. So I just want to note that for the record, but we do understand the intent here.
Thank you. Finance?
Teresa Calvert with Department of Finance. We agree fully with the Department of Social Services comments that to, clearly suspend the program would require the deletion of the intent language.
Okay, thank you. LAO? No comment. Any public comment? If not, I will ask for a motion per my earlier description.
So moved.
It's been moved. I'll second. Please call the roll.
Chesbro.
Aye.
Blumenfield. Jeffries. Mansour. Monning.
Aye.
Has 2.
Okay, thank you very much. And I will ask for the word to be put out to Mr. Blumenfield to try to get here. So, thank you very much.